Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the pleura. What is pleura? Pleura is a serous membrane that lines the inner surface of the thoracic wall. It lines the lungs. It lines the upper surface of the diaphragm. So the pleura is a serous membrane. It has two parts. It has two components: parietal pleura and visceral pleura. The pleura is lined by simple squamous epithelium. We call it mesothelium. Okay, we got the mesothelium. The mesothelium is also found in the peritoneum, in the pericardium. Okay, we got that. So visceral pleura is also called pulmonary pleura. And the parietal pleura has divisions. We have the costal pleura, we have the cervical pleura, the mediastinal pleura, and the diaphragmatic pleura. So these are the components of the parietal pleura. The costal pleura lines the inner surface of the thoracic wall, and it is separated from the thoracic wall by means of endothoracic fascia. It is the costal pleura. Cervical pleura. So here is our costal pleura. Costal pleura. Pleura is here. And cervical pleura, also called copula or dome of the pleura. This is the cervical pleura. Cervical pleura. Okay, this is cervical pleura. Cervical pleura. Okay. This is mediastinum. We know that mediastinum are the group of structure that is present between two pleural cavity. This is the pleural cavity containing lung. This is another lung, the left lung, the right lung, and these are present inside the pleural cavity. So this is pleural cavity. Inside the pleural cavity we have the lung, right lung, here left lung. So this pleura here is a part of parietal pleura. We call it mediastinal pleura. Mediastinal pleura. Okay, we got that. This is the diaphragm, and over the diaphragm we have the diaphragmatic pleura. So diaphragmatic pleura, mediastinal pleura, cervical pleura, costal pleura, all of them are part of the parietal pleura. They are lined by mesothelium, the simple squamous epithelium. We have the pulmonary pleura, we have the visceral pleura, also called pulmonary pleura, pulmonary pleura. Okay, that is also lined by simple squamous epithelium. Okay, we got that. The cervical pleura is above the clavicle. So this bone is the clavicle. Okay, is above the clavicle. This is the clavicle. Okay, so this pleura here is the cervical pleura. It is above the clavicle anteriorly. It is about 2.5 centimeter above the medial third of the clavicle, around 5 centimeter above the first costal cartilage. So that is the cervical pleura. The cervical pleura is reinforced by the suprapleural membrane. The cervical pleura is reinforced we can say is strengthened or reinforced by the suprapleural membrane, suprapleural membrane, also called Simpson's fascia. What is suprapleural membrane? Suprapleural membrane is a thickening of the endothoracic fascia over the apex of the lung, and this suprapleural fascia, it keeps the lungs inside the thorax. Even if we take very deep breath in, inspiration, the pleural cavity does not blow out in the root of the neck due to the presence of suprapleural membrane. So it is the thickening of the endothoracic fascia. It is also strengthened by muscle fibers from the scalene muscles. Okay, so we got the cervical pleura. Then costal pleura, that is present at the chest wall. We have the endothoracic fascia between the costal pleura and the rib here. Okay, so there is the endothoracic fascia. This is the diaphragm. We will get the diaphragmatic pleura. This is the mediastinum. This is the mediastinal pleura. Okay, we got the parietal pleura. Now we go to the visceral pleura or pulmonary pleura. Same as pulmonary pleura. Pulmonary pleura. Okay, it covers the lung. This shiny layer over the lung is the pulmonary pleura or visceral pleura, and it covers the entire lung, including the fissure area. It goes along the fissure. Okay, it is only absent in the hilum of the lung and along the pulmonary ligament. So it is absent along the hilum of the lung and the pulmonary ligament. Okay, so we got the visceral pleura. Now we'll go to the pulmonary ligament. What is pulmonary ligament? Pulmonary ligament is formed by two layers of mediastinal pleura. Okay, is formed by two layers of mediastinal pleura. From the lower part of the root of the lung to the diaphragm. Okay, so it should be from here continue down to the diaphragm. This is the pulmonary ligament formed by approximation of the two layers of mediastinal pleura from the lower part of the root of the lung going to the diaphragm. Idea is that this pulmonary ligament is important. It works as a dead space for the pulmonary veins, especially during physical exercise. So the root structure may go down through that. Between the two layers, we have loose irregular connective tissue. So if they are dilated, we have some extra space to go down there. Now also, it holds the diaphragm holds the lung to the diaphragm because this is connected to the diaphragm. Okay, these are the importance of the pulmonary ligament. You must remember it is formed by the mediastinal pleura, extend from the lower part of the root of the lung to the diaphragm. So we know that what is root, what is hilum, we have that idea. Hilum is the space, and the space containing multiple structure, those are the root. Root include the bronchus, artery, pulmonary vein, lymphatics, nerves. Okay, these all are root, and it is confined in a particular area on the mediastinal surface of the lung. That space is called the hilum. Okay, we got that. Now we have just covered the pulmonary ligament. Now we have to know recess. In the parietal pleura, we have the recess, costodiaphragmatic recess. Costodiaphragmatic recess is a slit between the pulmonary pleura. It is a slit between the costal pleura and the diaphragmatic pleura. So it is a slit between the costal pleura and the diaphragmatic pleura. Okay, so this is the costodiaphragmatic recess. One, another one is here. This is the costodiaphragmatic recess. What is the clinical importance? This is the most dependent part of the pleural cavity, so there may be collection of fluid there. Okay, and also this gives some extra space for the lung. When lung expand, the inferior border may go down to the costodiaphragmatic recess of pleura. Okay, we have also costomediastinal recess of pleura. Okay, costomediastinal recess of pleura. Okay, this is a slit between the costal pleura and the mediastinal pleura. A slit between the costal pleura and mediastinal pleura. Okay, it is prominent on the left side here, is more prominent here, okay, than that of the right side. Okay, we got here when the lung is expanded, anterior border can go there to that space. Okay, we got the costomediastinal recess and costodiaphragmatic recess. Now we have to know the reflection of the pleura. Of the pleura. Okay, the parietal pleura. So from the first costal cartilage area, it goes to the sternum angle, the fourth costal cartilage, to the xiphoid process, follow the costal margin. Okay, so in the mid-clavicular line, it is around T8 level. Mid-axillary line, it is T10, and the paravertebral line near the rib neck, it is T12. Okay, on the right side. On the left side, from first costal cartilage, okay, it goes to the midline, and both of them are in close approximation, although the pleural cavities are independent cavity, but the reflection of the pleura coming close together near the sternal angle. Then it goes to the fourth costal cartilage, then it goes to the sixth costal cartilage, then it follow the costal margin, going again, we have, it is T8 level here. Okay, then in mid-axillary line, it should be T10 near the vertebra, it is T12. Okay, there is a reflection of the pleura. So we have to remember 8, 10, 12. Okay, reflection, so that lung can expand properly. Lung normally in expiration go to T6, T8, T10. Okay, so there is some space for the lung to expand. Okay, we got the reflection of the pleura. Now we'll go to the blood supply of the pleura. Okay, we'll go to the blood supply of the parietal pleura like our body wall. Okay, so blood supply from the intercostal artery, superior thoracic artery, especially for the cervical pleura, superior thoracic artery, we have the internal thoracic artery, we have also contribution from musculophrenic artery. Okay, these are the blood supply. Okay, so the arterial supply to the parietal pleura. Okay, we got that. How about the venous drainage of parietal pleura? Venous drainage. Okay, blood supply of parietal pleura. Okay, we got again the intercostal arteries, especially posterior intercostal arteries, superior thoracic artery, musculophrenic artery, internal thoracic artery. How about the venous drainage of the parietal pleura? Venous drainage again will go to the intercostal veins, internal thoracic vein, internal thoracic vein. Okay, and we know intercostal vein ultimately goes to the azygous vein, azygous venous system, okay. We have the azygous, hemiazygous, accessory hemiazygous vein. We got the venous drainage of the parietal pleura. How about lymphatic drainage? Okay, lymphatic drainage, intercostal, posterior mediastinal, internal mammary, and diaphragmatic lymph nodes. So intercostal, posterior mediastinal, internal mammary, and diaphragmatic lymph node. Okay, we got the lymphatic drainage of the pleura. Now we have to find out the embryology. Okay, so we have done the blood supply of the parietal pleura. Let's go to the blood supply of the visceral pleura. Blood supply of the pulmonary pleura, or visceral pleura. Okay, that is visceral pleura, pulmonary pleura or visceral pleura. Okay, same as visceral pleura. What is the blood supply? Blood supply is from the bronchial arteries. Bronchial arteries. Okay, we got that. How about the nerve supply of the parietal pleura? Nerve supply of the parietal pleura. Okay. Nerves of the parietal pleura, like our body one, from the intercostal nerve, most important, intercostal nerve, and the phrenic nerve. Okay. So we got the nerve supply of the phrenic nerve. You have to know it. Also, mostly it will innervate the diaphragmatic pleura and mediastinal pleura. Intercostal nerve mostly innervate the intercostal spaces. Okay, nerve supply. It is painful. It carries pain sensation. But how about the visceral pleura? Nerve supply of the visceral pleura, or pulmonary pleura. Okay. Nerve supply is that of the lung. We know that. Visceral pleura, the pleura is inseparable from the lung tissue, and developmentally the visceral pleura develops from the splanchno-pleuric mesoderm, and the parietal pleura develops from the somatopleuric mesoderm. So the nerve supply will be, the pulmonary pleura should be autonomic nerve supply, sympathetic, parasympathetic. Sympathetic from T2, T3, T4, T5 segment of the spinal cord. Parasympathetic is from the vagus nerve. Okay, the visceral pleura is not pain sensitive, but it responds to stress, and it is supplied by the sympathetic innervation, so it will respond to vasomotor action of the sympathetic supply, plus some physiological reflexes by the vagus nerve. So that is related to the pulmonary pleura. Pulmonary pleura is not pain sensitive. Okay, but it is associated with the stress reflexes, vasomotor action, and the reflexes associated with the vagus nerve. Okay, we got the nerve supply of the visceral pleura. Okay, so now we go to the embryology. We discussed that The parietal pleura is developed from the somatopleuric mesoderm. The visceral pleura develops from the splanchno-pleuric mesoderm. Okay, we got. So this is our mediastinum. This is mediastinal pleura. This is the costal pleura. Okay, this is what? This is the mediastinal pleura. Mediastinal pleura. This is what? This is the hilum of the lung that contains the root. This is the costal pleura. Costal pleura. Okay, we got that. And here we get the heart here. This lung, another lung. We have fissure. Along the fissure we'll get the visceral pleura. It should go along with the fissure also. Okay, we got the structure. This is the root of the lung. We have discussed. This is the pulmonary ligament. This part formed by mediastinal pleura. This is the pulmonary ligament. Okay, and this is the structure in the root of the lung. We have the pulmonary artery with the pulmonary vein and the bronchus. Okay, we got that. Now we learn some clinical anatomy. Okay, where our lung may go through infection or inflammation. We call it pleurisy. Inflammation of the lung. We have another term, pneumonia. Pneumonia, that is infection of the lung. Infection of the lung. We have pleural effusion. This collection of fluid in the interpleural space. Collection of fluid in the interpleural space. Okay. We have collection of chyle, that is called chylothorax. Collection of pus, that is called pyothorax. Okay. We may have pneumothorax, collection of air, pneumothorax. There is collection of air. This is a potential space between the parietal pleura, visceral pleura. There is a potential space. In our life, it does not exist. The parietal visceral pleura come close together, and there is negative pressure there for any injury or disruption of any congenital cyst or bleb or instrumentation. If this is open, then air will go inside it. Negative pressure, maintain the lung to be expanded, so lung would be collapsed. We call it pneumothorax in that condition. Then mediastinum may be shifted depending on the condition. We may have spontaneous pneumothorax, we may have tension pneumothorax. In tension pneumothorax, there may be some blockage in the passage of air, so air is entrapped, air cannot go out. That is life-threatening condition. Okay, so we have collection of fluid. It may be exudate, that is rich in protein. It may be transudate, that is less, that contains less protein than that of the exudate. We have another term very commonly we use, that is called pleural rub. Pleural rub. Okay, pleura. The pulmonary pleura, visceral pleura go close together without any rubbing in normal person, because we have some fluid, very small amount of fluid that actually just allow the visceral pleura and pulmonary pleura together. So in some condition, is there an infection of the pleura, so there may be adhesion of the pleura and the pleural surface may be rough, and we'll get the pleural rub. If you place stethoscope, we'll get the pleural rub. Friction sound between the parietal pleura and visceral pleura, that is usually painful. Okay, and if the patient stop breathing, there will be no pleural rub. Again, he or she breathe, then there will be pleural rub. So that's all about the anatomy of the pleura. If you like my video, please support my channel. Please subscribe me. Please share the information with your friends. Have a nice day. Bye now.